Professor Dr. Anjana Singh. Professor Dr. Anjana Singh is executive member of Special Committee of ASA and academician of Nepal Academy of Science and Technology, NAS. She has published more than 120 articles in international journals, various books and book chapters, abstracts and proceedings, and peer reviewers of more than 6 journals. His expertise is in water microbiology, immunology, and infectious diseases and plant health. Professor Dr. Anjana Singh is going to present the talk on impact of COVID-19 pandemic on women in Nepal. A glimpse. Please, Professor Anjana Singh, the floor is yours.
Good afternoon.
Yes.
I would like to.
Yes, you are audible, Professor Singh.
Thank you.
Go ahead.
Thank you. I'm going to share my screen first. Is it seen?
Yes.
Hello?
Yes, we can see that. Yes.
Okay. Thank you. First of all, I would like to thank the organizers for giving me an opportunity to present this piece in front of you all, especially the organizers are Pakistan Academy of Sciences, Malaysia, Korean Academy of Science and Technology, National Academy of Young Scientists, Pakistan, Inter-Academy Partnership, and ASA. We all know that we have 17 goals globally, out of which 18 goals has been selected from Nepal, which has to be taken care and then focused on. And in this, goal number 3, according to globally, Nepal has focused is as one as good health and well-being. However, due to this pandemic COVID-19, it's not been met till date. And however, in addition with this, achieving the SDGs that requires the partnership of governments, private sector, civil society, and citizens. With this, I would like to add that similarly, in the case of this pandemic, COVID-19 pandemic, this is very true as in the SDGs that has been stated. And I like to make sure that we leave a better planet for the future generations. And Nepal right now, in April 2020, been able to produce one COVID-19 Nepal preparedness and response plan. And in this, however, the planning has been well made and it has been already in published form that has come up, but the work is still under construction and it's not being met, as we know that till now, right now, Nepal has been hit hardly with the second phase of this new variant of COVID-19, which is obviously it is the UK strain, but it is a little bit more mutant as it has been found in India. Similarly, this strain has been found in Nepal. Within the week of this April, we've been hit hard, and almost that especially in Kathmandu, the capital, we've been hard that every home they are having this COVID-19 infected person. So as we know that according to Ahmed Gad also, according to 26 June 2020, COVID-19 pandemic has affected many aspects of global economic, social and healthcare systems, and has also made prominent the level of progress made in achieving the sustainable development goals. And right now, the COVID-19 pandemic has shown us the new world that we really need to work hard in the aspect of health and development. And as part of a global effort to strengthen the global health security, The 2030 Agenda and its SDGs aim to address global health needs and to make necessary developments. And with this agenda, that is 2030 of this SDGs, all countries should and can address disparities in pandemic response. And in this, good health and well-being is the one that is the third SDG goal, which is now has become very important for all the countries to develop their capabilities for early warning, risk reduction, and management of national and global health risks. And in this progress, on this front with the Global Action Plan for Health from September 2019, example has been put forward that though there is much room for improvement, COVID-19 highlights again the necessity of building robust health systems is needed. This has been quoted in the April 2020 this preparedness proposal. And for the first time in a century, we have seen that the world is focused on a common goal that is defeating COVID-19. And this COVID-19 is forcing us to revisit our values and design a new area of development that truly balances economic, social, environmental progresses as envisioned by 2030 Agenda and the SDGs. In Nepal, like funding that is being required for humanitarian country team, they have selected preparedness for about 10.04 million USD and response that is for about 28.23 million USD, in which hub and satellite networks has been identified and health emergency operation centers and point of care centers has been identified, which can be seen in this map of Nepal. However, this COVID-19 has really hit the emerging gender, that is above all are being hit, but here we can also see that women has been also hit by this unprepared the pandemic that has been occurred right now. For example, increased stigma and discrimination linked to caste, ethnicity, and gender, an immediate need of women on front lines that they have been overlooked, and including menstrual hygiene supplies, especially in the rural areas of our country. And especially, I don't only say that it is the rural areas, but outside the capital, it's been seen. And serious threat to women's economic empowerment and livelihood, especially in the informal sectors, unpredictable and severe travel bans that has been put impact on women migrant workers, and interrupted access to sexual and reproductive health services. And also it has effect on increased risk of GBV, that is gender biased violence, and disruption of mechanisms for GBV prevention and response. And it has worsened burdens of unpaid care work on women. When we talk of this fund required for preparedness, there have been some pillars that have been identified. Like there have been 10 pillars which has been identified, which is almost equal to other countries also, similar to other countries. Coordination, planning and monitoring, protection, risk, communication and community engagement, health, that is including all the surveillance, rapid response teams and case investigations, point of entry, national laboratories, infection prevention and control, case management, operational support and logistics, primary health care and reproductive health, food security and WASH, and nutrition, education, shelter, socio-economic, early recovery, etc. So similar as this, in the funding required for response is almost similar, but only that protection layer has been, and earlier it was in third point, but here it has been taken as a seventh point. Here in Nepal, lockdown since March 24 has occurred in 2020 for about almost 3 months, which has really hit the economical and academic and health and every aspects, which is almost similar to other parts of the world also. And it has disrupted services, particularly with no physical access to work, to field visits and monitoring and verifications in agriculture, confined to text work, especially designs, drawings, reports, and virtual meetings and virtual lecturing to the universities and institutes. Issues concerning quality of work done at fields affected due to lack of monitoring, as in some cases, which is still continued, and research bench work is really affected. So because of that, most of the researches has been affected, and the publications has been also affected in this area. And in this case, all are affected where women are more disproportionately affected, especially the practitioners and the science people. And right now, in our country, what is happening is UK variant detection has been found, and it has double mutant strains has been also found as in India. So since we have the open border from India to Nepal, so most of the what is happening in India, it immediately it comes to Nepal. So the new first case has been identified in February 17th, which is the only one that was found in Kaskid district, that is the middle of Nepal. And that time, what was happening unprecedentedly, these cases, it increased up to 149 averagely. And right now, the vaccination has been also done in about 1.9 million people in India, in Nepal, where from India, COVAX AstraZeneca vaccine was purchased about 1 million in doses. And Sinopharm, that is in March 29, Chinese vaccine has been donated. Has been approved, but now till now 1.9 million people has been vaccinated. But unfortunately, the problem is, can you go to the next slide, please? Yes, unfortunately, the problem is that we are not being able to have the second lot of vaccination. But recently, just 5-6 days before, that is AstraZeneca vaccine has arrived in Nepal for the second dose, but it's only given to the health workers and the people who are the frontliners, like in bankers and health workers and those business people who go abroad. So because of this, what is happening is that most of the people who are already vaccinated as well as non-vaccinated people are getting infection with the second variant of COVID-19. So here I have the data here is like in yesterday's, this is the data that has been given here in Nepal. 2,00119 confirmed cases has been identified till yesterday. Death rate is about 3,164. So per day new cases is about 3,032 till April 25th data. So it shows that this is exponentially increasing in Nepal. In lower to the left in the map, it's showing that the hot spots, which is shown in the red mark, and orange is the milder one. And however, it has been infecting the other districts of Nepal quickly also. And to the right extreme, to the lower side, you can see that red bar, it's showing that within the, from March 30 to April 26, it's exponentially, it is increasing. So it is in, Nepal is in now danger period. And however, women scientists in laboratories has been also affected, like wet lab procedures, experimental research, and also after the lockdown and between also restarting lab works that has been left over. It's very difficult to restart, and it has been disrupted. The experience has been disrupted, and additional guidelines, that is especially the health safety guidelines in workplaces, restrictions in accessibility of equipment, reagents, and lab supplies. Since we mostly rely on the lab supplies from India, so it has been also very much affected. And most of the researchers we are in middle, and we have stopped in middle. And besides this, domestic violence and child abuse is increased. And pandemic, it has invited health safety guidelines in the workplaces and restriction accessibility, equipment, reagents, lab supply, which I have already just presented right now. Even the reliable internet, we are not getting, even now, like I'm afraid that I don't get interrupted in between. And obviously mentally and stress level has been increased, and there is a reduced productivity in academically as well as in business level also. The influx of thousands of jobless migrant workers from abroad and within the country poses an extra risk of violence against women and children in Nepal. So with this, I would like to quote one statement here that when we talk of publishing in journals, that there has been seen that big drop in the submission of manuscripts by the women in journals. So there are a few recommendations that has been put forward, and some policies is needed for flexible working hours for women and because women, they need to take care of their family needs and family care work also. And besides that, support to increase paid family leave and paid sick leave, or introducing no reduction in pay for reducing working hours. And there should be some kind of introduction of subsidiaries and vouchers for the use of telecommunication and technology for work, as we are using our personal, we are using this internet from our personal economy, which is again adding plus financial burden to household. And it's a promotion of good practice of sharing care work burden that will change the social norm. Support to adapt to new contexts by learning new technology and maximizing opportunities, like, for example, like virtual training, virtual meetings, seminars and webinars, and web-based work suitable for women professionals for now. And right now, as from the Friday, we are going to have again lockdown, second lockdown again in the country. So we are going to have again the effect on all of the sectors, including health, education, business, and environment and everything, in agriculture and all. So continue to ensure physical and mental well-being by staying positive and spreading positive messages through social media and webinars, and encourage and establish work from home culture in the future to strengthen family bonding. With the advancement of technology, it has proven that office duties can be fulfilled by working from home as well. This figure I would like to show in front of you all, because during this period of time, this lady, she's doing a small research for her thesis work, PhD thesis work, and she is working outside in the garden in front of the university building, and she's breastfeeding as well as working lab in a computer. So these are the things that we have seen, the hurdle that has been posed and suffered and by the females. And this cartoon I would like to show here is that workload and hurdles in a career competition between men and female. That you can see that there is lots of work that has been that has to be done by females in comparison. But however, I feel that some few men, obviously, they are also working hand in hand with women, and this is
Now we come to our third speaker,